National epidemiologist Dr. Michelle Francois sought to explain to the nation the process of contact tracing. In the last week, St. Lucia's total of COVID-19 cases has increased from 15 to 18. While 2 of the new cases had contact with persons previously confirmed to have the deadly virus, the 18th case, a 51-year-old male, did not, nor did he have a travel history.
Contact tracing is essentially trying to find all the individuals who have been in contact with a confirmed case. These individuals will be assessed based on their level of risk and their level of exposure, and a determination will be made as to how best to proceed with these individuals. Persons who have been exposed and are at high level risk, these individuals, an assessment is made of their homes to determine whether it is possible to remain at home in quarantine or whether these individuals should be quarantined at an isolation facility or our quarantine facility. The teams are working on the ground as we speak. Individuals have been contacted, individuals have been brought in based on the level of assessment. These individuals have been brought in so that they can be very closely monitored by our health team.
Dr. Francois says contact tracing is a measure being used globally to ensure that the virus does not spread in the community. She stressed that even though the individuals who have been contacted may not appear to have COVID-19, they must be monitored until it is determined they are not infected.
The Ministry of Health and Wellness would like to reiterate that these cases, these persons who have been brought in are only for monitoring. We are following up these individuals. It is part of our normal and standard procedure where we assess individuals based on their level of contact, on their level of exposure, and if they are not able to remain at home within the community for follow-up, then they are taken to our facility where they can be monitored by the medical staff there.
Meanwhile, Assistant Division of Fire Officer Jermaine William responded to questions about sightings of ambulances on the East Coast. Williams says this is standard operating procedure for contact tracing.
I cannot speak to the whole operation because it was a Ministry of Health operation supported by obviously the fire service, but I cannot speak to the details of the whole operation. But there was no intent to cover anything up. I mean, we know in St. Lucia that we're dealing with a pandemic, and we know persons will have to be moved. Okay, it's not the first time that we have used several ambulances to move persons from the scene of accidents. So, I mean, there's nothing sinister going on.
Recently, the Ministry of Health expressed its concern with the emergence of cases on St. Lucia's East Coast, while Prime Minister Alan Chastanet on his official Facebook page stated that authorities have been receiving reports of illegal entry of people into the country. Colby DeVoe, HTS News Force.